A very good evening to the listeners of Rehabilitation Science Group today. And we have a special guest, an international guest today, Dr. Shantanu Mallik. Dr. Shantanu
A
Mallik
very
will
good
be
evening to
discussing
the
about
listeners of Rehab.
Shantanu Malik will be discussing about the types of cupping therapy. Dr. Shantanu is BPT from Dhaka University and Masters in Public Health. He is also certified in professional cupping therapy and massage techniques. Dr. Shantanu is presently working as a consultant physiotherapy at JPUF at the Ministry of Social Welfare in Bangladesh. We welcome you, Dr. Shantanu.
Thank you, sir. I am your student also, sir.
Uh, I'm proud of you,
Yes, sir.
Shantanu.
Thank you, sir. Thank you, sir. It's a great honor for me to uh, share my little knowledge in front of my teachers. And I'd like to thank to Dharan Pandey sir and also Shagun Agarwal sir, because always when I just remind them, they are always ready to assist me. And I think you are my mentors in life and in this physiotherapy field. And I'm very overwhelmed from Bangladesh that I am trying to share my little knowledge on cupping, because cupping therapy is a very vast topics, and today I would like to share the some part of the important things that is very essential, and it's maybe differ from a lot of places, like some people they are interested on some different type of presentation, but today I would like to present the main thing, like how many cups are available in the field. And first of all, and already my mentors and teachers, Dr. Harvi Singh sir has mentioned my some introduction, and that is enough for me because I am his student. And also I am giving little lecture or sharing my knowledge in front of Bangladeshi students, those who are involved in different medical field, not only physiotherapists, but my presentation is especially for physios, because physios nowadays cupping therapy is a very newest weapon in the field of treatment or manual therapy, because I'd like to express my knowledge in different how you can easily prescribe. So on my topics, I would always prefer that soft tissue mobilization is first techniques. So that's why cupping therapy is one of the another important tools. Those physios are eager to learn and new topics, and that cupping therapy they can introduce on their regular basis practice, and then they can enhance their power. So first of all, I would just quote our father of medicine, that is called Hippocrates, and he is the scientist, and he quoted some word like, if you diminish and neglect the expression of the ancients and beliefs, that you will find the right pathway only in the newest treatment. You fool yourself and the people around you. Like always I used to say, that is, we learn everything from past, and from that experience we continue our present and we predict our future. So ancient beliefs, ancient thought, and ancient way of treatment, that we should always follow. We are not a creator like new things, because we always got the knowledge from past and we are maintaining our present. By past and present, then we predict future. So by creating new things, it's not mean that you are all in all. You have to respect the previous creation or previous ancient belief or something already that have passed. Like you can't count without your father or mother. So before that, your parents come first. So you have to be careful about your past and then respect. So cupping is also is a very important that is creation in the past, and nowadays some of the special physios they are practicing it, and they have found that it's a very fruitful, or it's a very effective one. So I will strictly go to my main topics like types of cupping. But before that, what is cupping? We can say that it's one of the oldest and most effective method of releasing toxin from the body's tissues and organs. And here we know that we eat a lot of vitamins, carbohydrate, minerals, and everything for our body, or for our living organs, or for being alive in the world. But that energy that are stored in our body, how they are moving to the target organ, that is the important things. Like bloods are moving around our body, but another, like our rest of the fluid also moving. But energy that is we can get from, like sunlight, we are getting energy. But we take food and then we can get energy. So that energy also needs movement to reach out towards the our targeted organ. Or like if we say that is our unique of a body is cell, then that energy should reach up to that. So this pathway also is defined by Chinese traditional medicine, and there they found it that is called QI or Gai. And this is very important because when this flow of the energy is stuck in the body, then we'll call it stagnation. And that's why the imbalance is occur in the body. So some part will deprive, like the deprivation, or they are not getting energy, and some part will get more energy. So there is the imbalance, and that's why a disease will occur, or some pathological change will occur, or physiological imbalance will be there. So that's defined by defined QI system, or Chi is very important, and in cupping is very important, this Chi or QI system. And also there is a lot of definition by different time, like so cupping, most of the time it's we believe that it's an ancient treatment. But nowadays, after that is Rio de Janeiro, after 2016, we have found that Michael Phelps, he has got more than 6 Olympic gold medal. And then we have found that he has some rounded scar mark, or rounded red marks on his body. And then we begin to that is get importance, that is something is there. So what type of treatment he has taken. Then we have found that his uh, physio, that is that lady has introduced that cupping therapy towards his body. And that is the now new thought, that is cupping is now introduced in physiotherapy, is very common way. But in ancient, you can see some pictures, and there are a lot of traditional ancient time, like in the Egyptian, or in Middle East, and some others, China, and some Africa, and North America. A lot of places they have introduced in ancient time. That's cupping. But the cupping is especially at that time is mostly introduced by the richest family, or king's family, or king's palace, like that's the high richest palace. And that time it's a very costly treatment, or it's a kind of a surgery. It's not common among the poorest, or the normal people, or ordinary general people. It is common treatment for the richest and the high elite families. So that time, when it is common among the some tribals family, they are used to use the horn. And after that, it made by wood, or made by stainless steel, or then glasses. And this traditionally it's improved, and in nowadays we are using the plastic. So you can see some pictures here that indicates the. But in China, it is coming after the death of Jesus Christ. And then you can find some books there in 1826. The Surgeon Charles Kennedy wrote it about the essay on cupping, and there you can see some that is illustration. They are cupping shape, and equipments you can find that book. So I already mentioned that Michael Phelps, after that 2016, we are seeing that cupping marks, and then we are more eager to learn these topics in the field of physiotherapy. And some countries they have different name. So in Bangladesh or the subcontinents, it is named as a shringa. It is common. You can find it in Ayurveda. So this is coming from Ayurveda also. So that is the different method, like 2S method. So in any other session we can go for that furthermore. But at first you have to be more careful. That is anatomically we are giving the treatment from our surface, like skin surface. So skin surface has a three layer. So epidermis, dermis, and hypodermis. But you have to be careful that in cupping there is two type of version, like dry and wet. But in case of wet version, someone maybe think that it is an invasive method. No, it is not an invasive method, because we are just cut up to epidermis region. We are not cutting any dermis or hypodermis. If that anybody have done that, then it is wrong. So that's why it's not called invasive method. So we are just open up the epidermis, and then by the suction power we are sucking the blood, or blood with wash product, and then it is coming out from the pore of the blood vessel, small blood vessel. So it is not leaked naturally when sweating is there. So blood, what blood normally blood vessel does, like they secrete or wash out the wash materials through pore to the skin. So same process we are doing through the cupping in that in the surface, and then put pressure, and that is passive way. But sweating is the active or physiological process. So in our body that is very important, like hepatic system, lymphatic system, and immune system, that is create our defense. So skin is the defense, large defense organ. So when you are applying the cup set on the skin, so you have to think about this system also. So we will encourage that system. And I'll go, because today we have only 45 minutes, so we will discuss the gist of the things. Here, very important thing we have to be reminded about the basics anatomy. That is, lymphatic system is our cardiovascular system is a closed loop. There is no leak. But for lymphatic system is a carrier to carry the waste product from the extracellular fluid, and also it is encouraged for lymph node and another part of the body to for protective mechanism, like immunity or everything, they also help. So it is first role is to collect the waste materials, and then it carries to directly to the vessel, like vein, and also it will collect the, the dangerous items in the lymph node, and otherwise it will also release that is protective mechanism also. So it is very important things, and mechanism of healing, that is also details in on my details presentation, like 2 days lecture on details on cupping. So we have to be remind some local pain mediators, that is important during cupping. We can modulate, or we can change the rate of secretion, or we can decrease the amount of these local pain mediators. And chronic disease changes substances, and cartilage destructive substances, we can change this type of normal process we can control by applying cupping method. And this chart is very important, like those nowadays, before that physios are mostly called like our we are earning our bread and butter by treating muscle. But nowadays we are more focused on fascia also, because fascia is a on a structure that covers all part of the body and separate it from others, and also it has a only single connection is it can connect from head to toe. So whole connection is there. So we will mainly focused on the myofascia, fascia also. So fascia and muscle both we are now treating. So the so we have to be think very carefully about that. Like when the fascia create pressure on the muscle, like 40 to 60%, then the muscle's full circulation will be zero. So we have to treat it the soft tissue, fascia and muscle alone. So in case of any mechanism in the soft tissue, I think everybody know about that. But just for reminder, I would like to say that is macrotoma and microtoma. This is the two process we can get the injury structure that is overloaded, and then in the cell matrix there will be some certain stress response. So if physios treating some patients who are is involving in sports, then when you are giving optimal loading and with the training effect, like patients are maintaining your water and they are following everything, so then the training effect will be there and spontaneous resolution of the system, and then the symptoms, and then when you are applying the optimal load regularly, then regeneration can be possible. So all injuries, if the patients are following your direct that is instruction and the following the proper physiotherapy guideline, then they are maintaining it, and you are guided, your guidance should be like a maintain the optimal loading, or which activity after injury, which activity you are the patients are doing through their injured part, that should be optimal level, and then the regeneration will be happen. Because we used to know that when we are born, then we our body is full of epithelial tissue, but after injury most of the part of the body, like the respected part is like face and tongue, or some part is different, but other part of the body is not after injury epithelial tissue is replaced by fibrous tissue. So we will not get the epithelial tissue again, like same way that before. So the mechanism is when there is the part of the injured soft tissue is full of blood supply, then there should be a after injury, if the blood vessels are damaged, and then there you can find the classical inflammation. So after classical inflammation, when you are applying optimal loading, then fibrous adhesion, fibrotic change will be there. So the fate will be the resulting fate of the injury will be fibrous adhesion. So PGOs should think about that. At least you will gain the fibrous adhesion response of the soft tissue that are full of blood supply after. But if the patient is not maintaining or following your water, then continuing the abusive load, then that soft tissue injury will go directly to the chronic degenerative change. And those parts are not full of blood supply, especially like the vertebral discs and sometimes ligaments and sometimes the tenoperiosteal junction. This part are not full of blood supply, so they are there. The fate is common and fixed, like cell atrophy and then degenerative change, and then when you are maintaining, they are putting again abusive load, that will be chronic degenerative change. So lot of medical professionals are there, they are fighting against each other, and we are also fighting, and we are doing lot of work for the vertebral column, but the result will be at last that patient will be go to the chronic degenerative changes. So be careful, or think yourself twice, that is you will fight here, because lot of co professional are there. So better you can work for the muscle or those who part are inflamed, then go at least go optimal loading and give the fibrous response, or regeneration is the best choice, rather than fighting against some part, those who are at least the fate will be the chronic degenerative change. So here I will go directly to part is here I can show you that all physiotherapy treatment are from outsider to inside. Like all big synovial joint in our body is knee joint. So inside the joint capsule you will find no blood supply and nerve supply. So like there is only synovial fluid is there. So this synovial fluid is only increased by movement. There is no alternative. Maybe after 25 years, when robot will be available in this market, I think then you can find that okay, physios are no more record, robot can do. But at least now we can say that we are the only alternative to serve or increase that joint synovial fluid, because only movement can increase that synovial fluid. Other rather than shortwave or any other heat modality, it will not increase. So by applying cupping, that create negative pressure on inside the joint, because cupping can create up to 4 inch. Like here, it is the example of diameter like superficial, then fatty layer, then superficial fascia, superficial skeletal muscle, deep fascia, deep skeletal muscle, and periosteum and bone. This is the just a reminder and how we can put our cup in the front, and then we can get the result. Like here, when you are pressing some axis symmetric finite element model, there you can see that when you are putting cupping over the skin, then up to 4 inch we can create a negative pressure. So it must cover all vital part in the body. So if we are putting in front of the chest or back of the chest, we can cover at least inside the main vital organ. So a lot of things are there, but in a short time, it is very tough to cover everything. So 2 days course, I would like to just finish it in a some part of that. So before that, going to type of cupping, it is very important to go for contraindication. You have to know the which is very contraindicated. Like I will go through that. They do not use cupping when there is a high fever or for convulsion or Crohn's allergy condition and ulcer is sore. Cupping should not only be done soft muscles and should not be done where the muscle layer is thin, especially for the child and older person. Their skin is very soft. So then the time, like we are used to carve in 5 to 15 minutes. So it is essential to maintain that time little bit low and follow the session very carefully. Like a blister formation is very common for older and child. And they use the proper sterilization and take extra care, and do not apply strong cupping to the face and on forehead, because that will change the emotion. And treat the abdominal area for pregnant women should be more careful, and inflamed the cut skin should be avoided, and extra care skin do not cut the vein artery, because we are not going up to dermis or endodermis. So so avoid during severe edema, so and also the serious heart disease. And then the absolute contraindication, there some contraindication you can't cup. So tuberculosis of the lung, neoplasm, hemophilia, then hypotonia, anemic condition, menstruation, during menstruation, and sometimes you can do for some reproductive system disorder also. So sometimes you can mix up, like menstruation you can do or not, but during menstruation it is absolute contraindication. And deficiency for like severe diarrhea, when fluid loss is there in the body, then will not again encourage to by cupping you can go for fluid loss. Dry you can do, but wet absolute contraindicated. And arrhythmia and coronary insufficiency and angina complication. So here for indication, we can go for some purify blood, activate medulla, improve blood flow, tool muscle, stimulate lymphatic system, train conjunctivitis and control, and pressure clear blockage, and protect from poisoning, and save from allergy and relieve pain. So cupping has some two effects. Two, two, two things is very essential, like segmental and regulation. Like you have diagnosed or assessed that part is some trigger point, or you have found tenderness over there, and you try to release that pain from there. So then you can go for regulation therapy. Just put the cup and then, or you go for massage. That is regulation. It's not indicating that you are putting a specific point for a specific reason. So for segmental reason, that is important. Like you are treating some heart condition, then you have to put a specific places. That is called segmental, and regulation is very important. Then I'll go for like here we have two type of autonomic nervous systems. So like parasympathetic and sympathetic. So if you try to find out which area is parasympathetic, like sacral region or cranial nerves, or for thoracic region, which is thoracic and lumbar region, you can find sympathetic. So here the function of the sympathetic is fight or flight, or where the parasympathetic region is rest and digest. So like somebody's heart rate is high, then you have to use the area like this parasympathetic area can decrease that heart rate, or somebody heart rate is low, then you can use the sympathetic area, that the area for cupping. So then heart rate will increase. So lot of thing is there, some point is there, but here I will go like mechanism of cupping is depends on. I have discussed mainly on my lecture is 10 type of activation like embryonic theory, reflex zone theory, pain gate theory is very common in our physiotherapy practice. Prostaglandin theory also common, and endorphin enkephalin production, increased blood circulation, nitric oxide theory. It is started from 1998 and by two scientists, and after that they have got the Nobel prizes. And energy channel theory is the meridian line theory. Genetic theory is for another new invention and activation of immune therapy system. So I will just go to the embryonic theory is important because on embryo you can see the three layer. So ectoderm is the outer layer which by bond we can see that it is indicates the nervous system. So when you are cup on the skin, so it stimulates the nervous system. Reflex zone is same things like you are applying on the skin. So some sensory that is from the posterior root horn, and it directly on reflex pathway it crosses to the same pathway of the anterior horn, and then the motor reflex will be there. But some head zones is indicates that when this reflex pathway is gone, some part of that sensory nerve also represent the viscera or some systems, so that by the direction we can also stimulate that viscera or systems. So here like heart, if you want to stimulate some any heart condition, then you have to go for C3 to T4 on predominantly left side. Then indirectly or you can stimulate the heart. And some segmental relation is like on dermatome you can stimulate according that nerve also. And pain gate theory, it is very common among the physios, they know, and they used to use a lot of equipment, electrical stimulation that so maintain the pain gate theory. And prostaglandin theory, when applying, then prostaglandin is released, then endorphin enkephalin also released, and then increase the blood circulation after giving cupping, then circulation increase. And nitric oxide theory, they already said there's some after nitric oxide release there is a vasodilatation, muscle relaxation, antithrombotic, decrease in inflammation and prevent stenosis. So fourth channel is for like fourth channel is here the 14 meridian line is there, two conceptual. So through maintaining this conceptual line we can treat our systems or organs. Genetic theory is a very large part, so that take a lot of time, but through cupping we can change some part of genetic systems, and activation of immune system also possible through that cupping. So here I will directly try to show you the cup set. So you can call my okay. There is 12 type of cup set here. So I want to show that is the glass cup is there. So I go to glass cup. Here is the glass cup, or you can't see, but here is the I have there the glass cup is there. Then there is advantage is there, and also disadvantage is there. And then bamboo cup, I have that bamboo cup. So bamboo, it is mainly used for the it is not expensive, but It is a long time you can last, but it is mainly used for that is that called the herbal medicine we can use for that. And rubber cup, there is different type of rubber cup out there, but I have this one. So this is the rubber cup, red, and this type of rubber cup are available. And then silicone cup, also silicone cup is very effective for massage, and you can use, and any other time you can give the practical demonstration also. And here the electrical magnetic cupping apparatus, it is not very available in the market, but already on the way I'm already give I'm on the way. Maybe it will take in the first of the new month, next month I can get this machine. It is very effective, and you can get some change on the shape of your buttock and also your breast. And also it is auto effect there also. You can rhythmic cupping can be possible for this machine. And then this is the screw on top. So I would like to say, show you that is screw on top cup is like this way. This is the screw on top. So this cup is very effective for people those whose skin are soft, the people are old age or child, and their and this is the common cup set available in the market. You can see this is the pistol hand cup set, pistol handed bow cup set, and plastic cups are available here. Plastic cups put here and give here, and then pump by this pistol hand. And here is the magnetic squeeze cup set. This cup set is a special application, like this is called red, and this is called blue or something. So there is a magnet out there. So magnet means this red color indicates the cathode, that is called negative, and universal anode color may be differ, like black, this is green, and then blue, any color or white you can choose, but for universal cathode color is negative. So what we are doing, like by this cup set, we are make a battery, like we are trying to drain some extracellular fluid or swelling or something, we try to drain it from the our affected part. So what we'll do, we'll put our positive in the just up of the target organ or target joint, and then negative part will put it to the distal, because always we know that negative will go towards the positive, that is there will be the circulation in the battery. So we will put the negative negative marking or cathode little distance distal to the affected part or swelling part, and then here by this creating battery we will that is encourage the drainage process. So here the another is disposal cup, like disposal cup are in the available in the market. So here this cup is we are only used for wet cupping, because after collecting blood from the body, like is maximum 25 ml will come out, but it is not common for every cases. I can't do complete like 25 ml. It is less than like 5 or 10 ml is commonly we have got. So so this cup, after using this cup, we will just put it on the dustbin. So that's why it's called disposable cup. And then this is the another part is chime. Okay. So this is the cup set is electrical, like here you can see this cup is like a double stimulation. Now we can get some vacuum IFT. So there you can see some same effect, like cupping suction negative pressure, and then the rounded now rounded pad is there for positive and negative, and then this is create a double stimulation like electricity and also cupping. So those who are creating stimulation on the skin, so you can get the same benefit like a vacuum IFT. This is very effective in the soft tissue injury, and you can after 2 or 3 sessions you will see dramatic responses. And this is also some cup set is like there is a squeezing rubber on the top. So here you are putting here, so it is very soft. Like for those skin are very fragile, and you are giving the single punch and do cupping there. But it is very available in the market like milk sucker. Those women are worker, like they are working in the job sector, they are busy. So for newborn baby they are sucking that their milk and store it on the bottle. So this is very common, but it is also like a cup with a skin rubber top. So another thing is a traditional. You can see some traditional healer. They are using this horn top. So horn top. This is I have got from my one of my favorite teacher. He is a boss in India, like Arunmoji Ranganathan sir. He has gifted me. That is it is also common in India. You can find it. So this is for traditional use, but before that the traditional healer they cut their hole and use their tongue to suck it and block it. But nowadays we are not using this much, but some part of the Middle East or Malaysia or Singapore you can find that. But they are using some fire for use that cupping set. So here after that we can find that that is the important thing is cup set is a professional cup set. So here I have that on professional cup set. This is a Korean version, and this cup set is very looking very good, and it is very effective. I think it's very hard, and you can use it without any hesitation, and that's uh, box is very precious. Like when you are go with that box in before in ancient time, our village doctor carrying some box or like that. But it is very hardy, and that's calves can you can use for dry and wet version. But this box is little bit price high. So after that, I will go little bit. Okay. Okay, I will just today my main topic is this, but already I have discussed a lot of things. But here the you will find out the type of cupping. So type of cupping is very important. Like you can find 5 type of cupping in the field or in Google or any other places. But here I mentioned the 6 type. This is my creation. I have found 6 type of cupping in nowadays, but in future we can find more. But in technical type you will go, that is there is a 4 type of like dry and wet. Like when you are applying the cup and then not cut that part body part, that is called dry. And when you cut that body part, through 2 way we can cut. Like we can use 11 number surgical blade, and then we can use that cut, and that is called hizama. Another name is called hizama, and we can do that. But nowadays we are using pen, that is called hizama pen. So by this pen we are giving the single punch, and here we can use some needle. That is also is look like a diabetes needle. So that needle we can go and use that, and so for single pumps, and that that will not create any spot. So when you are using this there is a surgical blade for wet cupping, that will be the scar mark will be there. And also sometimes somebody will cut the vessel also. So there is a little bit careful and some need lot of experience. So better you can for first comer, when if you are interested for wet cupping, then use this type of Nizaman pen or wet cupping pen. So that will be more helpful for you. And then massage means when you are applying the techniques for only massage, that is called massage. But when you are applying this cup, glass cup with a fire and put it and put it up, put it up. That is called flash cupping. So for power of suction related, it is totally four types. Like light means you are applying the cup like when you are applying the pressure, like single pull. When you are applying single pull, that means on 41 millibar Pascal equal to on push means on Pascal equal to the on 41 millibar. When you are putting two push, then there is a 254 millibar. So like that way, like when you are applying light, well, by light cupping, then that is mean is a 100 to 30 millibar. So when the medium, that is 300 to 500, below 500 millibar. When you are going for a strong cupping, that is more than 500 millibar. So that will take more, at least more than four compression or four pistol pump. So for percentage is totally depend on the machine, because that those machine have the versatile capacity. There you can find that versatile maneuver. And method of sucking related, that is you are applying, if you are applying the try to create the suction by applying that fire here, like you are applying fire here. You can go for cotton or tissue there, and cotton or tissue over there, and then you have to go for sanitizer. Like sanitizer, that is 70% alcohol. So this alcohol you put there and then get it burn or flame there and then put it there and go. So that is called fire cupping. So here the glass cup are used for fire cupping, and also the bamboo cup I have shown, that is heat also by fire cupping. And also here you already shown the horn cup. These are also by the fire cupping. But rest of the cup set are like you can apply by this cup set. You can do it by manually, like manually you can pump it, so it is very easy manually. But for like rubber cup you can do manually, like put it here, and I can show you that's smaller. So you just put it here and then place it here. So here just single pump, so it will be remain there. So this is manually. But when you are applying pressure, that is creating suction by electrical device, like here uh, I have that. You are creating cups, that is the electrical gun. So you are electrically automatically that creates suction. So that is the different issue. So that is called electrical. So when if you are applying any materials inside the cup set, that is called material inside related cups. So like herbal, so you are using this bamboo cup for herbal cupping. So when we are like we have three kind of that is fruits available in the market or herbal medicine. In Bangla is called amloki, bohera, hortoki. That is sometimes is also similar name in India also. So that type of fruits we are natural fruits we are using, and we will put it inside a bowl for and then we have to boil it up to 30 minutes, and then put this bamboo into that boiled water for 10 minutes, and after sorry for 5 minutes, and after that we have to put it out and rest it for 1 minute for heat absorption, and then put that bamboo by fire cup on the patient skin or affected part for up to 10 minutes. So there will be nothing but that herbal product will remain released on the patient up to 10 minutes. So by using 10 to 10 session is enough for controlling any problem for that patient. And for eyes, like when you are applying eyes inside the cup set, like put eyes there and then put there. It is especially during the acute session, like we are applying price or pricer or love or peace and love theory. There we can manage our physiotherapy field. We go for acute management. There ice and cupping double effect will be there. So for water, like we are using some hot water that is not too hot, but is controlled by body temperature. Then we are applying that hot water with cupping, that is for dry cough for child. So that water using also a method for cupping. And ozone, this is the ozone gas are using, and that method is totally different. So by using ozone we are detoxifying our body. And hot and moxa, like moxa is one kind of process. It is a herbal product, and that is commonly used in China traditional medicine. There sometimes different type of cup are there. They are using cup and with moxa. And when you are applying needle, like dry needle, that is called very common in our practice. So dry needle with cupping, that is called needle cupping. So nowadays we are applying small needle like 13 size or 25 size inside, then apply cup there, and then we can get the double benefit. Like needle is a invasive method, and with that dry cupping we can get the surface. Both are surface stimulation therapy, but this is the double effect. But when we are applying magnet inside the cup, like this rubber cup has magnet inside here, so we are applying here, or I have shown you that squeeze that head squeeze rubber cup. So magnets are inside. So inside there is a magnet. So that is called magnetic cupping. For the area related treated related types, like pedicupping means when we are cupping, that is the sole of our feet, that is called reflexology. So we are treating some condition by giving massage or cupping massage or stationary placement of the cup. Then that is the called the pedicupping. And abdominal condition, we are applying lot of abdominal cupping, and that is we are called commonly abdominal cupping. And for facial causes like cellulitis or some glossier looks, for we are using some different direction, we are applying the facial cupping. So that is also known as a facial cupping. And for orthopedic reason, specifically for orthopedic reason, we are applying cupping, then it is called orthopedic cupping. For male genital organ, like if we want to replace Viagra or anything for better response or sensory stimulation, then when you are applying this male genital organ, this is called the male cupping. And for if we want to resize our breast size for female, then that is called the female cupping. So in case of sports, we are using different techniques or different time duration and different method of applying cupping. So that is called sports cupping. So like that for hamstring cramp, you are applying the cup along the course of the muscle, and then stay for 3 minutes, and then go for proximal part movement like hip joint movement first 10 times, and then knee joint movement 10 times, and then release all cup, and then massage that cup from insertion to origin, that immediate release the cramp. So that is a very nice technique in sports. And aquatic, like aqua, when we dipping in the aquatic, like in the we are using our buoyancy it is when we are moving, like after any type of major injury, we are not allow the patient to move in the against gravity, rather than we used to go for hydrotherapy. So before applying the cup, that is mainly dry cupping, and then ask the patient to submerge in the water, and then they can get some double benefit or double effect, like buoyancy will push from the down to up, and the cup will from outside. So there is a double challenge connection. And for cosmetic purpose, for the breaking the skin and some cellulitis and some great looking or some scar management, that is called the cosmetic use of cupping. So that is my today presentation. I think in near future we can discuss more. So today I can finish for today. So thank you, sir, for giving me such a scope, sir.
Thank you, Dr. Shantanu. Thank you for the elaborative presentation on the types of the cupping therapy. And we come to know the different type of the technical and the type of the your suctioning and to the type of the your different material, area related, and the other cupping types of the methods. Uh, just the we would like to know how much pressure means sometimes if it is the electrical goes is there, then it's okay. But when we are having the mechanical part, how to measure it? How we can find it out? It is enough. What? How much pressure it is enough?
Okay, sir. Sir, already I have mentioned that is the single punch. Single punch means 140 on millibar.
Okay.
So double punch is 254 millibar. So here when we are applying light cupping, like very light, we will just maintain our pressure. The punch is like 1 or 2 is enough, or 3 highest. So for medium, like those structure, when we apply for any fast application or any first time application on a patient, if your application will be the experience, but for patient it is first time you are applying. So then you have to first judge that is light and then try to move underneath the structure. If it is well moved, then you can increase. Otherwise, in case of child or in case of old person, you have to be remain between light and medium, not strong. But when that patient is more okay and that structure underneath you are palpating that is very tough, very fibrous, very stuck there, so they can you can use for strong for that. And for severe pain, you can first start pulsatile mode, but pulsatile mode is not possible by manually. So if you have that machine, then you can select that mode, sir.
Thank you, Dr. Shantanu. And we would like to call you again because our all the viewers want ki there should be specific cupping techniques they want to learn from you. Okay, so we
Yes, sir.
would request you ki you should come further on our channel and just show the different types of the cupping onto the specific area.